I'm Dr. Astha. I'm consulting dentist in Citi Neuro Center. So today my topic will be Bell's palsy. Palsy means paralysis of a muscle accompanied by the loss of sensation. Paralysis means weakness of the muscle. So the facial paralysis, we can term it as neurological disorder of the facial muscles, which is associated with the loss of sensations also. It can be actually two types, which is central and peripheral. In central, it is actually loss of only lower half of the facial muscles. The paralysis includes only this part of the facial muscles. In the peripheral, it is half of the face, that is including from the forehead to the lower half of the face. So what can be the etiology? Etiology can be actually trauma to the temporal or the facial nerve. It can be tumor which compresses the nerve. It can be diabetes mellitus. It can be pregnancy hormones which actually causes Bell's palsy. It can be any type of viruses, that is EBV or the herpes virus. It can also be, we can say, stroke. Stroke also causes the central type of the facial palsy. So the central facial palsy, what we are talking is, there is loss of only the nasolabial fold and drooping of the face. This sulcus is known as nasolabial fold. In the epilepsy, in the peripheral type of the facial palsy, it is including the loss of forehead movements, eyelids, and the nasolabial fold and the drooping of the face. So the idiopathic reasons for the peripheral facial palsy is actually known as the Bell's palsy. Now, the causes I have already told. What can be the pathophysiology? Means the cause which actually aggravates the inflammation of the nerve that leads to the swelling of the facial nerve, and then followed by the compression of the nerve that leads to ischemia and the necrosis of the nerve, which leads to the paralysis. So what are the clinical features of the facial paralysis? Normally it is idiopathic. Now reason is not known, especially in the Bell's palsy, and usually the pain starts from the backside of the ear, masseter area, temporal area, 2 to 3 days before the paralysis. Followed by the muscle weakness that increases in 48 hours. Followed by, there is the movement of the forehead and the eyebrows is not there. Drooping of the eyelids is there. Inability to close the eyes. This nasolabial fold goes. Drooping of the mouth will be there. If the drooping of the mouth is there, definitely the saliva will be coming, and the patient is not able to control. Saliva will be drooping. Same is with the eyelids. Since the patient is not able to close the eyes, there is continuously tearing of the eyes. In the mouth area, since the patient paralysis is there, there is slurred speech and the patient has having dysphagia. The loss of sensation, taste sensation also goes off. Hyperacusis. Hyperacusis means there is sensitivity to sound. There is more, a patient is more sensitive to small amount of sound also. Now the diagnosis part. The diagnosis part is, first is the physical examination. We will ask the patient to move the eyebrows or close the eyes and speak some words, followed by electromyography. In this, we actually detect the presence of the nerve damage and the severity of the nerve damage. In electromyography, there is stimulation by the electrical to the muscle, which actually stimulates the nerve also. In case of tumor, we have to rule out. There will be MRI and the CT scan. Treatment. In the treatment, it includes the corticosteroid, that is a prednisolone, which reduces the inflammation of the nerve and the swelling of the nerve. Even antiviral drugs are supposed to be given in case of Bell's palsy, which actually helps in the prognosis part. The facial massage, electrical stimulation, hot fermentation, these are the other techniques which can be actually used in the treatment part. Even the surgical treatment is also available, in which the passage is actually elongated to from where the facial nerve goes off, but it is little bit complicated, and there is some loss of hearing or some complications are also available in that.